This week we'll be talking about massage, and we're going to focus on three separate techniques in this video just to give you a clearer understanding of the differences. So Swedish transverse friction and edema reduction. We'll start with the Swedish massage, which is what most people are probably more familiar with. This is typically the technique that you get when you pay for a massage. It's used primarily for muscle spasms, adhesions, and postural strain. So you'll be learning, if you haven't already, about the main strokes, the effleurage, petrissage, and then tapotements. And there's several different types of tapotement techniques that are talked about in the class, or in the notes in the book. A few guidelines when you give a Swedish massage. One is that your hands should be warm, dry, and clean, so be sure to wash them before you give a massage. Maintain good posture to prevent fatigue. It's easy for you to wear out as the one that's giving the massage. The pressure should be delivered through your body and not your arms, so try to think about that, that your body, your feet are in line with the forces that you're applying, and we'll practice that in lab as well. Change pressure depending on the amount of tissue that you're massaging. So if there isn't much tissue in that area, you need to lighten up on your pressure. Avoid bony prominences and painful joints. Maintain constant contact with the patient. It's easy to take your hands off, and especially when you're adding more oil or lotion, but try to maintain contact so the person knows where you're at. And the massage should not be painful. This is a relaxation massage, so there shouldn't be pain. And then pressure should be in line with venous flow. Transverse friction is the next massage. This is a massage that's done to a very small area to break up adhesions or decrease pain at a trigger point. It's often used with chronic tendon inflammation. So our picture here is for lateral epicondylitis, so inflammation of the wrist extensors at the origin. Do not use a lubricant such as oil or lotion when doing transverse friction massage. Otherwise, you're just rubbing over the skin. What we want to do is have the friction between the skin and the inflamed tendon. So don't use any lubricant. And you want to keep the tendon on stretch during the treatment. So for this example, you can't see this, but the wrist should be in flexion. And ideally, we'd have the elbow in extension. That would provide a little bit more stretch, but sometimes that's difficult to do and be able to find the lateral epicondyle as well. So when we practice this, you'll, for example, if you're providing transverse friction massage to the patella tendon, you want to have the knee in flexion. And then the last one is an edema reduction massage. For this one, you started, let's say it's the ankle that is really swollen and it's been that way for a while, so you're going to use massage to push the edema out. You don't start at the toes and push all the way up at the leg. We start where the edema begins as you go down. So maybe the edema begins about the malleoli. So you start your massage there, and you'll work just that proximal inch of where the edema is at, pushing the fluid towards the heart with the strokes. After you've worked on that for a minute or two, you're going to move 1 or 2 inches more distal, and then you start pushing from there. So it's kind of like you're moving the fluid along, but if you push it from the very end, nothing is going to move. You have to push the edema up from the beginning or the more proximal area, and then start to slowly work your way distal in order to what they call uncork the edema. So that will give you some guidelines then for those 3 massages, and as well as the book to help you finish your study guide.